Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Roy, I see from your notes you've been admitted because of shortness of breath. Can you tell me more about that, please?
Yeah, well, it started last week. I noticed that getting up the stairs was more of an effort, and I found that I had to pause on the way to catch my breath.
Right.
I did used to get a little out of breath, but it's definitely gotten worse. I normally manage to go shopping with my wife, and we walk to the shops and back. I generally have to have a little rest, but now everything is just taking me longer. I feel weary,
Mm-hmm.
and I've got this cough. It's like a barking thing that I just can't shift. It's worse at night when I'm lying down and I get a bit wheezy. I'm just really tired because it keeps me awake for most of the night. My wife has been sleeping in the spare room because it's keeping her awake. I've also sort of been bringing things up when coughing. Without being too graphic, it's quite thick. It's a sort of dirty green color, I suppose.
Right.
It wasn't like that at the beginning of last week. It was just clear. But over the last couple of days, I've noticed it's changed color, and I'm coughing up a lot more.
Mm-hmm.
My wife was starting to get worried, so she made me an appointment with our doctor, and then he sent me here.
Okay, Roy. Do you have any other symptoms?
Yeah, I was really hot yesterday, and I thought it was because the heating was on, but my wife hadn't turned it on. Then the next minute I was shivering. I guess I'm feverish?
It sounds like you've been really suffering. Have you got any other medical conditions?
Well, I was diagnosed with this lung condition last year. I've forgotten the name of it. Hold on. Hang on. I'll get it. COPD, is that it?
Yeah.
Well, anyway, they told me that my lungs weren't working as well as they could be because I used to be a smoker.
Right.
But I quit about 6 years ago. To be honest, I think it was because I worked in the mines and it was really dusty. Either way, I've got it, and it makes me a bit breathless, but nothing like this.
Right.
And I also get gout from time to time, and I take something called allopurinol or something. I've also got arthritis in my knees, but that's just because of my age, so I just put up with that.
You mentioned taking allopurinol.
Mm-hmm.
Are you on any other medication?
Well, the doctor gave me inhalers, and I'm using those. I'm getting better at taking them because I found it a bit confusing at first. I've started to take my blue inhaler a lot more over this last week because I've been so breathless. I take the stuff I mentioned before, a statin for my cholesterol, and then the odd paracetamol when my arthritis starts to play up. I don't really like taking pills, but if it keeps me going, then it's worth it. Also, I'm allergic to penicillin. I get an awful rash all over my body, and it's so itchy whenever they give it to me. Don't give me any of that.
We won't, Roy. You mentioned you live with your wife. Are you both managing at home?
Oh, yeah. We still get around the town to get our shopping and see the family. The stairs are starting to get a bit much now, so we're thinking about moving into a bungalow, but we haven't started looking yet.
Okay, that's good. Have you got any ideas as to what might be going on?
Well, I think it might be a chest infection because it's just getting worse. I just want to start feeling better.
Of course, Roy. It does sound like that might be the case, but we'll start doing some tests to make sure and begin treatment.
Now look at the notes for Extract 2. Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase.
Boy, age 10. Now take notes on the case history and current symptoms.
So your GP suggested you bring Tony in?
Yes, we've had a very bad night. He's had hardly any sleep, wheezing, out of breath and coughing. I was really worried, so I rang up Dr. Cooper.
Does he use a blue inhaler?
Yes, he's had one for years.
But it didn't help?
Not this time.
Is his asthma normally under control?
Well, he's had it since he was 4. I was worried about him going to school at the start, but he seems to manage most of the time.
Have you any animals at home?
No, he wanted a pet, so we got him a cat, but it made his condition worse, so he had to give it away.
Have you noticed if he's allergic to anything else?
Well, we try to keep dust down in the house.
Who did you see about Tony's asthma in the first place?
We were sent to St. Mary's and he had lots of tests to see what he was allergic to.
And what were the results?
He was allergic to lots of things.
So he was put on Intal, was he?
Yes, he took that for years regularly, but a year ago his asthma got worse and our GP changed inhalers.
Does he now use a brown inhaler?
Yes, he uses it regularly.
Is there anyone else in the family with hay fever, eczema or asthma?
Oh yes, my mother had asthma all her life. I had eczema as a child. On my husband's side, several people have hay fever.
Has Tony had any illness apart from asthma?
No, fortunately not. That's enough.
Has he ever had to come into hospital before with a similar attack to today's?
Yes, they put him on steroid tablets. Another time, he was rushed into intensive care and put on a machine to help him breathe.
Has he a nebulizing machine at home?
Yes, and a peak flow meter. The asthma nurse showed us how to use it.
What is Tony's usual peak flow rate?
300.
And what was it today?
100. He's been very restless all night and breathless. He took more and more puffs, but he's just the same.
Does anything special bring on one of these attacks?
It seems to be when he gets a cold.
That's very common. Well, Tony, I'm going to bring you into hospital to get you sorted out, all right?
Thank you, Doctor. That's a relief.
That is the end of Part A. Now, turn over and look at Part B. Part B, questions 25 to 30. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. Now look at question 25. You hear 2 doctors discuss the transfer of care for a patient. Now read the question.
Hello, Dr. Salvos. This is Dr. Broderick from the emergency department. I'm calling you with regards to an admission to the hospital medicine service.
Right, yes. Hello, Dr. Broderick. I'm the admitting physician for hospital medicine. Can you tell me more about the patient and why he needs to be admitted from the emergency department?
Sure. So the patient is a 68-year-old man with a past history of CHF, DM2, and a chief complaint of shortness of breath for 3 days. Chest x-ray shows a right lower lobar pneumonia. His vital signs are normal, but his BUN is 36.
I see. It sounds like he meets CURB 65 criteria for an inpatient admission. Have you started him on any medications in the emergency department?
Yes, we have given him supplemental oxygen and started him on breathing treatments. He will also be getting empirical antibiotic coverage. If there are any other orders you'd like me to place, let me know, and I'll do so.
Question 26. You hear a speech pathologist talking to the wife of a patient who has recently suffered a stroke. Now, read the question.
I just don't really understand why my husband can't speak properly anymore. Is it a result of brain damage?
Problems of this type are a result of damage to the brain, yes, but it's important to note that these issues haven't affected your husband's intelligence.
No, of course. I know it's still him. It's just frustrating when we can't talk like we used to. Will he get better eventually?
Your husband has shown improvement already, and we're confident that this will continue with regular sessions and practice. Patients tend to show the greatest change within the first 6 months, which is why we've planned such an intensive schedule for him during this time. We're confident that we'll see great strides in your husband's condition over the coming months.
Question 27. You hear a trainee doctor asking a senior colleague about chest tubes. Now read the question.
I'm still just a bit unsure about chest tubes. I was hoping you might be able to give me a bit more information.
Okay, sure. So you know about the 3 chambers on the chest tube, right?
Yep, there's the collection chamber, the water seal chamber, and the wet or dry suction regulator.
Right. So, as the air from the pleural space passes through the water seal chamber, you should see gentle fluctuation in the water every time the patient breathes.
Mm-hmm.
This is called tidling. If you notice that tidling is no longer present, the tubing may be kinked or obstructed, or the patient's lung may have re-expanded.
Okay.
You should also make sure the chest drainage unit remains below the level of the patient's chest at all times.
Question 28. You hear a pharmacist talking to a customer about pain relief. Now read the question.
Hello, can I help you?
Yeah, I get terrible backache, and my friend said you could give me some codeine for it.
Do you have a prescription from your doctor?
No, but I don't want the full-strength stuff. I only need the weaker one. You know, they mix it with ibuprofen or paracetamol, so it's not as strong.
Ah, okay. Well, first of all, there's been some research done recently that suggests that low-dose codeine doesn't offer much more pain relief than paracetamol or ibuprofen alone. We're not actually authorised to provide codeine without a prescription anymore, so I'd recommend picking up some alternative pain relief from the first aisle by the front door.
Question 29. You hear a trainee nurse receiving feedback from his tutor. Now read the question.
How do you feel you handled the patient's concerns?
Well, I think I was okay.
Mm-hmm.
Maybe I wasn't as confident as I could have been. I'm still quite nervous about advising patients. I guess I just need more experience to gain confidence.
Maybe, but I actually don't feel that was an issue for you. Do you think there's anything else you could have done for the patient during your examination? Well, you could perhaps have tried to be more reassuring rather than just stating the facts. Sometimes patients need to feel like their anxieties are being heard.
Yeah, I actually think I did cover this with the patient, though. He talked through his concerns while I was examining him.
Well, it's not enough for the patient to say they're feeling worried. You have to show that you're listening and reassure them that you're working with their best interests in mind.
Question 30. You hear two doctors planning their patient care schedule. Now read the question.
We have 24 patients in total to see today across 2 bays, and unfortunately, we only have 4 staff members. I think we should divide ourselves into 2 teams. Would you agree?
Absolutely. Also, I think we should see patients according to their national early warning score. That way we'll get through all those who have urgent requirements before lunch. Then we can be sure that the most pressing investigations are performed earliest, and the sooner we get those organised, the better. Phlebotomists will be coming to the ward at around 1:30, so any blood forms should be given to them then.
That is the end of Part B. Now, turn over and look at Part C. Part C, questions 31 to 42. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Now, look at extract 1, questions 31 to 36. You hear an interview with a physician called Dr. Matthew Leach, who's talking about meningitis. You now have 90 seconds to read questions 31 to 36.
Hello everyone, I'm here with Dr. Matthew Leach, an expert on infectious disease who's going to tell us about meningitis. Thank you for being with us today, Dr. Leach. Can you tell me more about the disease?
Sure. Well, first off, not everyone who is exposed actually develops meningitis, but there are some common symptoms to look out for in those that are at risk. It can be quite difficult for patients to realise they have meningitis in the early stages, as the symptoms can lead them to believe that they are developing the flu. They'll simply feel tired and achy for a few days.
Right.
As this infection develops, patients may then notice a sudden onset of fever, headache, and in particular neck stiffness. Other possible symptoms include nausea or vomiting, confusion, sensitivity to light, no appetite or thirst, or even a skin rash. If left untreated, bacterial meningitis is very dangerous, quickly progressing to seizures, shock, and even death.
Well, that sounds pretty serious. And you mentioned that certain people may be at risk. Now, which people are more likely to develop meningitis?
Well, there are many causes of meningitis, but one of the most severe is caused by the bacteria Neisseria meningitidis. The bacteria are spread by respiratory droplets and are often seen in college students. This is largely because of the sudden change in their lifestyle. College students, particularly those who live on campus, are exposed to a hotbed of different infections they haven't previously encountered. All these kids from different parts of the US and the rest of the world get together, live in small dorms with each other, go to parties. All that close contact really is a breeding ground for infection.
Oh, okay. Well, that makes sense. Now, can you tell us about a specific patient who had this type of meningitis?
Of course. I treated an 18-year-old man in his first year of college who was living in the dormitories. There was a flu going round, and he started to feel the same symptoms. He was working hard to try to complete a couple of important essays before the deadline, and he planned to delay going to the doctors until he had submitted them. Soon after the initial symptoms, however, his roommate found him in severe pain and feverish and brought him to the emergency department where we diagnosed meningitis. We took a sample of spinal fluid but started him on antibiotics before we got the results back.
So you mentioned that you started antibiotics before you got the spinal fluid test results back. Can you tell me why?
Right. As I mentioned, there are many causes of meningitis, like viruses, funguses, parasites, and bacteria. However, it can take some time to determine the exact cause, and waiting for the answer without treatment will make the patient worse. Instead, we use the patient's presentation, age, and our determination of the most likely cause to start antibiotics that would kill many of the causes. Once we get the results back on the cause, we can change the antibiotics to be more specific. By doing this, we don't delay treatment and are able to reduce the chance of complications.
Right, I see. So how is your patient doing now after being treated? Will he experience any long-term after effects?
Well, he is currently doing much better. He responded well to antibiotic treatment and regained his mental state within a few days. Unless the patient has a disease of his immune system, meningitis is unlikely to recur. Because this patient had some delay before seeking treatment, he may still have some side effects, but it will take some time to see what long-term effect it will have on him. Bacterial meningitis requires urgent medical treatment and can cause serious complications such as hearing loss, memory difficulty, brain damage, gait problems, or kidney failure.
Well, let's hope he makes a full recovery. And aside from seeking immediate medical treatment, what advice can you give to our listeners today about bacterial meningitis?
So, first off, there is a vaccine that is effective at preventing this disease, so anyone in close contact with a large group of people, such as those living in a military base or on a college campus, should ask their doctor about it. Finally, if you have not had the shot and have spent a lot of time with someone who is later diagnosed with meningitis, wear a mask to prevent spreading the bacteria and go and see a doctor immediately. There are medications that can reduce your risk of developing meningitis, and getting treated immediately will reduce your risk significantly.
Now look at extract 2.
Extract 2 questions 37 to 42. In this part of the test you will hear a presentation by a consultant regarding Tourette syndrome. For questions 37 to 42, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Tourette syndrome is a type of neurological disorder characterized by involuntary tics and repetitive vocalizations. Latest research indicates there may be as many as 1 in 200 people affected in Australia. It commonly affects people between the ages of 2 and 21 years, with the majority of cases occurring in children aged 4 to 12 years. More boys than girls are affected. Milder forms of Tourette syndrome can be misdiagnosed, as it often occurs at the same time as attention deficit hyperactivity disorder, obsessive-compulsive disorder, and conduct disorder. This condition commonly appears first between the ages of 2 and 12 years. For some sufferers, there may be a lessening of symptoms in late adolescence. It is, however, a lifelong condition that is not degenerative. Most children with Tourette syndrome are able to exert temporary control over their tics and vocalizations, while others require a cocktail of medications. The cause is mysterious, but theories include bacterial infection, abnormalities in the metabolism of brain chemicals, and genetic factors. Since stress and emotional overexcitement seem to exacerbate the condition, learning relaxation techniques can help. Whether or not Tourette syndrome is linked to other disorders, such as attention deficit disorder or learning disabilities, like dyslexia, is still undergoing scientific debate. Sometimes the disorder can spontaneously resolve for unknown reasons. There is no cure. Symptoms. The symptoms of Tourette syndrome can differ from one child to the next, but may include a variety of tics, such as eye blinking, shrugging, and facial grimace. Milder forms of Tourette syndrome can be misdiagnosed, as it often occurs at the same time as attention deficit hyperactivity disorder, obsessive-compulsive disorder, and conduct disorders. At least one involuntary vocalization, such as grunting, sniffing, or barking, that is repeated over and over. Attacks of tics and vocalizations, either daily or regularly. In some children, other behavioral or learning difficulties, such as dyslexia or obsessive-compulsive behavior. Appears between the ages of 2 and 21 years. A waxing and waning of the symptoms over several weeks or months. Simple and complex. Tourette syndrome can be mild, moderate, or severe. The intensity of symptoms can change within the individual, sometimes on a daily basis. Stress or tension tends to exacerbate the condition, while relaxation or concentration eases the symptoms. Sometimes the symptoms come and go over a period of months. There are 2 broad categories of Tourette syndrome. These are simple, a milder version which includes tics such as blinking, sniffing, shrugging, and grimacing, and vocalizations such as grunting and clearing the throat. Complex, a more severe version which includes jumping, spinning in circles, and compulsively touching things, and vocalizations such as repeating words or sounds, echolalia, and swearing, coprolalia. Theories on what causes Tourette syndrome. The exact cause of Tourette syndrome remains a mystery, but research is focusing on a number of possibilities, including genetic factors. Tourette syndrome seems to be an inherited condition. A child of a person with Tourette syndrome has a 50% chance of developing the condition themselves. Boys are 3 times more likely to inherit the condition than girls. Streptococcal infection. The Streptococcus bacterium can cause a wide range of infections, ranging from mild to severe and life-threatening. One theory proposes that a particular infection may be responsible for the neurological changes. Neurochemical abnormalities. The chemicals of the brain, neurotransmitters, seem to be metabolized differently in people with Tourette syndrome, especially the mood regulators dopamine and serotonin. Other disorders. Researchers are divided on whether Tourette syndrome is associated with other disorders, such as attention deficit disorder, learning disorders, including dyslexia, and obsessive-compulsive behaviors, although they often appear together with Tourette syndrome.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.